All right, doctors, at this time I'm just going to do the procedure in real time, just to give a short update on this young lady here. I met Emily when she was 11 years old, and she had been having problems for approximately 5 years before I met her. She had a long history of recurrent sinus infections prior to me meeting her from young childhood. She did have some good chiropractic care for some neck and back ailments. The procedures that were done chiropractically, externally, had very little impact, and then that's where she was introduced to this methodology by referral. She's an excellent patient. She responded very, very well. She's here now. She's 14 at this stage. She was 11 when we met. Just had a short exacerbation, and I guess this is our third time that with the exacerbation. She did leave town, came back in, so we'll see if we get much bloody exudate out of her. But what I wanted to demonstrate is how easy and simple a young patient can tolerate this, and this is the way Emily was right from day one when we started this procedure. Mentholatum to lubricate the finger cut, and again I suggest to use a little mask in case it does stimulate some coughing on the patient's part. And the trick is to get the little cup, to get it into the inferior turbinate, a little air, and then I release it a little bit more. And there is some resistance at this stage. It's kind of snug, so we're just trying to work with it to see if it goes through. It's almost starting to move now. All right, the cough is a very common thing to occur. Very common to occur. And then ease up. Then we go to the other side and do the same procedure quickly. That's a girl. And she can feel, and I don't know if the tape is picking it up, but we can actually hear the palate moving as I inflate and deflate the balloon. Now I'm going into the middle turbinate, and then Brian, see if we can see the palate moving. Do you see the palate moving, Brian? That's it. We'll see if we can get that demonstrated. In the old days, you actually would have the balloon pop into the back of their throat, was the method that you wanted to use to make sure you have. But as you get better with this, you can just feel the balloon give, and that's the method I'm teaching you this weekend. The old timers would do it, and they would have the balloon pop in, and that's why I had this sharp piece on the back end. In case it got trapped, they would just pop it. But that's just a hair too aggressive. And the patient is instructed to breathe through their mouth, which Emily's doing quite well. We're doing all 3 turbinates on this patient, and once in a while you see that balloon pop out, so I'm just trying to compress enough to keep the balloon going backwards instead of forwards. You can follow up with some just auxiliary pressures. At this stage of the game is very beneficial. And then I have the patient come on up here with me. Have a seat here, Emily. Have you open your mouth nice and wide, head down just a hair more. Nice and wide, nice and wide, nice and wide. 1001, 1002, 1003. Very good. As you can see, there is a little bit of bloody discharge on my finger. We'll see how much comes out of Emily when she does her snorting and her blowing, etc. Last time I did it to her, or actually I should say the first time I did it to her with this exacerbation, there was a dramatic amount on my finger. Today it's very slight. Emily, how did you do in this, since I'm not really looking?
There's not much.
Not much, okay. So that was a big, big change from 2 visits, 3 visits to her, correct? Now we're going to see what comes out after she expels, because you want to examine the test. Now she's still got some bloody in this, so she's not as good as she was yet. Symptomatically though, you're feeling a lot better?
Oh yeah.
They'll always usually feel symptomatically improved before the blood stops. The goal is to get the blood stop. Now with Emily's case, when we first met her when she was 11 years old, it took a substantial amount of time. A number of months to get to that point at twice a week. But once we got it there, it didn't take much effort to keep her in that kind of shape when she would have periodic exacerbations. In fact, this last time, I think you fell off the wagon on doing all your good habits too, didn't you? Yeah, but she's back on plan B on wellness. All right, now we'll just do the same thing for the other side. Nice and wide. 1001, 1002, 1000. And this side here is a little more dramatic. And let's see what comes out in the sink here too. Okay, this one here is a little more dramatic, but again, nothing to the extent that it was when we first met each other. It would literally just drip out of her nose when we first got started. But you can see it's fairly, aggressive at this stage of the game, but that's okay. It'll all settle itself down.
5 years ago, I awoke with what I thought was ear problem, and I went to a medical doctor. She looked at my ears. She told me my ear was full of wax. She cleaned it out, gave me some antibiotics. I took the antibiotics, but nothing changed. I still had the pain. It was in the right side, and it just eventually started working its way. It started in the back, on the back of my skull, and eventually worked its way up into my right jaw. And after the antibiotics didn't work, I just started to do some research to try to figure out what was wrong with me, what was going on. I was guessing it wasn't my ear because I took the antibiotics and nothing changed. It just kept getting worse. But I've lived with pain in my right jaw for the past 5 years that it has radiated up into the side of my head, causes a lot of pressure in my ear, a lot of sinus. I was having a lot of sinus pressure and pain. Basically, I've been in pain every day of my life for the past 5 years, all in my skull. I've seen countless chiropractors in my area, and they've all done different manipulations on the neck down, but no one has ever addressed my skull. Just recently started seeing another chiropractor in my area, and he did some kinesiology testing on me, and had started asking me questions, had I ever had a head injury. And I started recalling that yes, I had had some head injuries, and he believed that what he was finding, everything was in my skull area. It was all in my head that was causing my problems. So when he brought that up, that made me want to dig into, well, okay, maybe this head injury, maybe that's caused some of my problems that I'm having. So I started getting on the internet and doing research, found out there's a procedure, what I call the balloon up the nose, but it's called endonasal specific or endonasal balloon, and just started doing a lot of research on that, believing that maybe that was something I needed to have done to me, that certainly nothing that I ever had done in my life or ever heard of it. And I did find a doctor in Dallas, Texas that treats, I did a TMJ Google search, and he does treat TMJ with the balloon up the nose, and actually had an appointment to see him on a Monday of this week, and I was really dreading the trip because the pressure that I was having in my ears, the feeling of being unbalanced, nothing spinning, but just feeling off balance continually was causing a lot of problems traveling in a car, a lot of anxiety, anxiousness, particularly traveling at higher speeds. So I was really dreading the trip to Dallas and doing a lot of praying and hoping I could find someone closer to home. And I just
Patty,
kept
can you come back to one, please, for a note?
And I just kept searching the internet, and finally found Dr. Fiscella. And I thought, well, St. Louis, surely to goodness, I can make it to St. Louis. And so my husband brought me here. What would have been a 3-hour trip turned out to be a 6-hour trip to get me here. But we have been doing the the nasal treatment and the sweep, the pharyngeal sweep. First off, though, when I first saw Dr. Fiscella, he looked in my ears. That was the very first thing he did, and just was amazed that he couldn't even see my eardrum, and told me that we were going to have to address that first to get the ears cleaned out before he can even see what's going on in there, because the wax had built up so much it was covering my eardrum.
All right, now we're going to go for the superior turbinate, and that one you just glide right up the angle of following the angle of the nose superiorly.
I got spit.
You got to spit?
Yeah.
Good, you gotta spit. Everything we're trying to do is to get her to expel.
I do have a question.
Yes.
Does all this have to do with tonsil nuggets?
Tonsil nuggets? Well, there's terms in the literature that talks about tonsil nuggets. Those are just going to be little specks of plugged
Why?
mucus, things of this nature. I'm
Yeah.
assuming that's what you're talking about?
Yeah, it's
Yeah.
in my tonsils.
Yeah, yeah, well,
I've
that-
dealt with that for years.
Well, this procedure would have been what medical doctors would have done to you prior to the 1940s for any adenoidal or tonsillar, sinus, allergy, sore throat, laryngitis, bronchial irritation, all that, they would have gone in and done this.
Okay.
So the tonsillar, pellets that you're talking about, those are just plugs that are part of the infection portion,
Well, yeah,
just like
they
a little
look
zit or
like
a blackhead.
infection.
Yes, that's what they are, because they call cryptic tonsillitis. And the tonsils should be like a smooth, but then they dry out, they get craters in
Oh,
them.
mine's got
So-
craters like
yeah.
the moon.
Because that's why you're in a situation when I milk you and all that stuff, a lot of that is the whole system is just backlogged. And it's been like that for
makes
years.
sense, yeah.
It's been like this for years.
You want to know how I get them out?
Well, what do you use, a toothbrush, you squeeze them, or a...
You know those little droppers, medicine droppers?
Yeah,
And I just go back in there and I just
try to
suck
suck it out.
Yeah,
Fine, whenever you get them out.
yeah.
Now, if you can find a guy up there in Paducah, Kentucky, he'll be able to get them out for you. And then last but not least, we have to go to the superior turbinate on this side. Now, sometimes you'll see the balloon doesn't get in there real good. You can work it in a little bit. If it unfolds itself evenly, fine. If not, you pull it out and you start over again. And that's why I go easy with my pressure and let the balloon try to... There we go. Pop goes the weasel.
Yeah. Wow, that stopped that ear up.
Yeah, that's very typical. It'll open itself naturally. All it is was just pressure was going in. The eustachian tube is over here. It just, and it's trying to pressure to equalize that. Nice and wide. Hold on for me. Hold on. 1001, 1002. Well done.
That one wasn't as bad as yesterday.
Good. You're not done yet. Make them on now.
Yeah, we got a chunk out of that left side yesterday.
Okay.
Battle
Now,
strategy.
I didn't feel this all the way up yesterday, should I?
Yeah, go ahead.
Yeah, okay.
Halfway, more than that, whatever you feel. Like I said, we're trying to do quite a bit because she's loosening a lot up quickly. So we want to rinse that out. Now, obviously, when you're home, you don't have to do as much. But if you need it, go ahead and do it.
Oh, okay, gotcha.
And that's not so good. That means, if she had just a smidgen, I said, hey, man, she's pretty much as humble far as I can bring her. But see, I haven't brought her to the level where she's gonna be. How do you know? Because the amount of blood comes out of her. The guy that I dismissed, I mean, I dug him out 2, 3, 4 seconds, 2, 3, 4 seconds. Not even a drop, like a smaller than a pinhead amount of blood. Your wife.
That was a chunk.
Like this.
Mm-hmm.
That's, I know it's a challenge distance-wise. So one, either find somebody who's closer to you, who's proficient at it, or we'll work something out.
I'm trying to find somebody.
I don't blame you. If I was in your shoes, I'd be trying to.
Well, I really would like to take you with me. That's what I mean, you hear me. I'd fly him to Paducah.